Assalamu alaikum. Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. So we have learned too much and educate about the decay crush and the mini crush. So my work and presentation dedicated to Rasul Kareem Sallallahu Alaihi Wasallam, the greatest ever spiritual physician. We have discussed this very well by the Dr. Hamid. What is the main concept of decay or any crush technique? The main purpose is to complete ostial coverage of the side branch and minimal metal at the carina. For this, the various crush techniques developed over the period of time, and the well-known and documented is decay crush. For the left main intervention, the decay crush is gold standard nowadays. This discussed by the Dr. Hamid. This is an evolution of the various crush techniques, starting from classical crush, evoluted to mini crush, micro crush, and then to decay crush, and finally this nano crush. The difference between the micro, mini, classic crush is the protrusion of the side branch studs into the main branch. If it is about 4 or 5 millimeter of the side branch stands in the main branch, then it is the classical crush, or if 2 to 3 mm, then it is the mini or micro crush, and less than that is nano crush. In classical crush, as discussed by the Dr. Hamid, we have a stent that crushed the side branch stent, and there is a metal in the carina more, at 3 or 4 mm of the side branch stent or 3 layer of the stents in the main branch. And any time there is a difficulty in rewiring of the side branch. There are some practical tips and tricks for recrossing, like as mentioned by the Dr. Hamid. If you have difficulty in rewiring, then change the shape of the wire, or you can use the polymer coated jacketed wires. And in a severely angulated side branch, we have option to use the angulated microcatheters. We can use the supercross, venture microcatheter, and in some cases, we can use the double lumen microcatheters. But make sure there is adequate crush of the side branch stent in any case. Otherwise, there will be difficulty in crossing the side branch studs. The mini crush, the motto or the theme of the all crush technique is the same. The mini crush is the same as we see the decay crush, but there is a less step in the mini crush technique. There is a loss of first kiss. There is no first kiss in the mini crush, and most of the time we use the mini crush with the 7 French system. We crush the stent with the crush. With the stent, the side branch stent being crushed by the main branch stent. But for that, we need at least 7 French guide. Another variety is the step crush, in which we use a balloon to crush the side branch stent, and that can be done with the 6 French guide. The decay crush is a gold standard or well-known technique for the left main intervention. The more data are on the decay crush in the left main intervention, but there is no head-to-head trial between the decay crush and the mini crush. So the results of decay crush and mini crush is almost same in terms of long-term outcomes. But as the decay crush and mini crush very well discussed by the other operators, so I'm going to focus on the nano crush technique. Nowadays, they're more focused on the nano crush due to many advantages, like there is minimal metal in the carina, and the rewiring is almost 100%. You can rewire this side branch in 100% of the cases. In this nano crush technique, we have a side branch stent. Definitely in any crush or any bifurcation technique, we need to prepare the main and side branch prior to deploying the stent. We use the 1-to-1 NC balloons for the preparation of the main branch and the side branch. We can use the first kissing balloon inflation for the main branch and side branch, and then deployment of the side branch stent while inflate the main branch stent. It is recommended that we can use the main branch stent according to the size of distal reference diameter, or 0.5 mm less than the main branch diameter. So we inflate the main branch stent and pull the side branch stent into the main branch. By doing this, there is 1 mm or less than 1 mm protrusion of the side branch stent into the main branch. Or sometimes there is just a lower edge of the stent come into the main branch, and the upper edge is just meeting the carina. We inflate the side branch stent and then inflate the balloon. This is the first kiss in this case, both balloon inflated at nominal pressures. So there is a distal edge of side branch stand being crushed into the main branch. And then we deploy the main branch stand and in the final kissing balloon. This is the concept behind the nano crush technique, in which there is only a lower edge of the side branch come into the main branch and being crushed. Now here is a case example. Can you rotate? I think this is a rotation. I'm sorry for this. I think there is some. Okay. If we see the first, is that same. Okay, I think we can appreciate the bifurcation here, this OM and circumflex bifurcation. There is quite angulated OM. I think we can make it. Okay, this is angulated OM branch along with the circ. So the most difficult bifurcation in the term of angulation or tortuosity are the OM and the circumflex bifurcations. So in this case, we used the nano crush technique. Definitely after preparation of the main branch and the side branch, keep a stent in the main branch and deploy the stent into, keep a stent in the side branch and deploy a stent in the main branch. You can see this stent balloon is inflated into the main branch and we pull the side branch stent. There is, here you can see, there is just 1 mm of the side branch stent into the main branch behind the main branch balloon. By doing this, there is no more coverage into protrusion of the stent into the main branch, and there is just minimal protrusion. This is a concept of nano crush technique. And then inflate the side branch stent and the main branch balloon. There one step is missing. After inflation of the deployment of side branch stent, we usually pull the side branch balloon into the main branch, and you will do the first kissing here. By doing this, the rationale is to crush the lower edge of the stent into the main branch. After that, the pot is mandatory. And again, then rewiring. The rewiring is quite simple in the nano crush technique because there is no more metal into the carina. There is no crushing of the stent into the carina. Just lower edge of the stent is crushed into carina. So the rewiring is almost 100% of the time in case of the mini crush in the nano crush technique. And after that, you can see there is complete coverage of the carina along. The final step is definitely the kissing and then the pot. So these were the main concept of the nano crush technique. The mini crush very well, I think, explained by the Dr. Hamid and other operators. So the steps are almost same in the mini crush. Yes. No, if you have IVUS, then it's always very good to do IVUS. I do most of the time by IVUS guided interventions. But if you don't have the IVUS and you use a stent boost or other technologies, then it's good enough. But main purpose is you size the vessel according to the stent, size the stent according to distal diameter, and use a pot balloon and the kissing balloon. Then it's most of the time you get a well opposed stents. Definitely, there is various studies published that I was getting. When actually when you have a resource problem or you are tune your eyes with the IVUS, then you, most of the time you use a stent bigger than the reference diameter. If like I most of the time when I don't use the IVUS back in 2016, 15, 16, the my stent diameter are 0.5 mm less than now I using. Like in most of the time, mostly I'm using the stents for 3.5 or 4 mm of diameter. Previously, I've used to put a 2.5 and 3 mm of diameter stent. You can use do the IVUS in any case if you have the luxury to use it. Otherwise, with the passive time with the usage of the IVUS, you set your eyes according to the IVUS. Like you put a at least 0.5 mm bigger stent than you used to do without the IVUS. So. Any question regarding the nano crush, DK crush or mini crush technique? Dr. Salman is with us.
This is a great presentation. So मेरी जो एक हमेशा nano crush के बारे में थोड़ा सा रहा है ये है कि you have to see the ostium. जो दिखाते हैं on the models or the papers में दिखाते हैं तो वहाँ पे there's a plastic model, you can see the angle, and I find it extremely difficult to sometimes see the ostium of the OM or the diagonal branch, because even if you go very extremely to the left side, वो angle से नज़र नहीं आता. So what I generally prefer to do is I'd like to do mini crush for that reason. So while we can do nano crush, I generally don't do it as much because I've seen other people do it and miss the ostium. And this is in a setting where people often also use IVUS. So I just want to make the comment, I don't know what your experience is. Asha, that was a very nice case. Lekin I avoid nano crush because वो 2-3 strut बचाने से I don't think इतना फर्क पड़ता है, because अब तो इतने thin struts हैं कि you can actually do a nano or a mini, so you can do a mini or a sort of DK crush and still get through that and open it up. That's just a comment, and I don't know your thoughts.
Very well taken point that initially there is a risk of loss of the ostium by doing this nano crush. But if you use a balloon to pull the stent into the main branch, then there is chances of missing the ostium, I think, is very less. If you use the nano in the same manner as in the case of mini crush, that you by visual eyeballing you decide to take only 1 mm of the side branch stent on the main branch, then there is a chance of loss of the or missing of the ostium is very much, especially in the angulated diagonal and the OM branches. When diagonal has a more than 70 degree of angle of the bifurcation, we try to pull the stent into the main branch and try to cover the lower edge of the side branch stent according to the main branch, but most of the time we lost the upper edge of the stent. So on those cases, that the mini crush I think is a good, because we have a balloon into the main branch inflated at lower pressure and 0.5 mm smaller size into the reference diameter, and we pull the side branch stent to the main branch, then the chance of missing the ostium I think is theoretically is quite less, but practically yes, we can have this. Theoretically, I think you are very right that there is maybe it's just technique to apply various types of the wind bifurcation. But I think this nano crush, I am not quite a very fan of the nano crush. I am mostly using the mini crush or DK crush techniques. But in the cases of angulated side branch, when you thought that if you miss or put a more stent in the main branch that have a huge metal at the carina, then the rewiring is difficult. In those cases, I think this nano crush technique is better than the mini crush or the DK crush. I personally use nano crush only in angulated side branch where I thought that I can end up with putting a more metal in the carina. Then this is a nano crush I think is a better in those scenarios. Otherwise, there is no head-to-head trials or data on the nano crush as compared to mini or the DK crush. Even there is no head-to-head trial between the mini and the DK crush. The only data we have in the bifurcation is about the DK crush.
Just a little comment. I think I would second the thought. The problem is we are inflating the balloon in the main vessel 1:1, and then you are pulling on the side branch. I don't think you can get the struts to go into the, because if you're 1:1 in the main vessel, how can you protrude the stent in
No.
the
Sorry,
main
the
vessel?
seam is not 1:1, 1:1 according to the distal reference or 0.5 mm less than the reference.
Difficult just to assess that if you have not missed the ostium or you are not too into the main vessel. I think if you are into the main vessel, just simple crush and then do the procedure.
And this is not to take away from your excellent presentation. You're absolutely right. Nano की philosophy यही है, but I'm just saying कि जिन लोगों ने सीखना है, because this is a workshop, नैनो की बजाय वो मिनी क्रश सीखें, because मिनी क्रश में आपके ऑस्टियम को मिस करने के चांसेस बहुत कम है, और आपको तमाम वो बेनिफिट्स जो नैनो क्रश के आपको मिलेंगे, कम मेटल एट द क्राइन एंड ऑल दैट स्टफ. And now obviously you're a माहिर के angulated branch में just land just enough metal into the main branch, but my feeling is कि when you're learning these things, I think mini crush tends to be a better way to do it, because you don't miss the ostium. Because sometimes on IVUS you think the ostium is coming on the lateral side, but actually it's coming on the medial side. And you get surprised because the branches will go around the main branch.
Very well taken point.
No,
Any question or comment?
We have a case on mini crush. हो गया?
Okay, thank you very much.
Let's start.